Health institutions across the world are tracking the spread of the virus. This map comes from Johns Hopkins University in Baltimore. You'll take a look. The red splotches are the cities in China most impacted. The bigger the dot, the more widespread the virus is. For more on what's next, I want to bring in Meg Terrell, who's been tracking the virus since the very beginning of this outbreak. Meg?
Well, thank you, Scott. And we're learning tonight the Senate Committee on Homeland Security and Governmental Affairs will hold a hearing Wednesday. The focus is whether the U.S. is prepared to deal with this growing healthcare crisis. One key witness is former FDA Commissioner Dr. Scott Gottlieb. He's also a CNBC contributor. And also joining us tonight is Dr. Amy Compton-Phillips, who oversees Providence hospitals in 7 states, including the hospital that treated one of the first Americans to be diagnosed with the virus. And doctors, thanks for joining us again tonight. And Dr. Compton-Phillips, we'd like to start with you, being one of just a handful of health systems that's actually had experience with this novel coronavirus in the United States. What can you tell us about what you learned from that experience and how long we know from both that data and the data you're seeing around the world about how long people are actually contagious with this disease once they've been diagnosed?
So we are definitely learning a lot about how to protect ourselves. And I think, having the first patient really helped us put to the test all the preparation we've been doing over the past several years. And now we've been able to test ourselves, make sure that those preparations are working to understand everything from how to use our personal protective equipment, how to use isolation chambers, how to use negative pressure rooms, as well as doing surge planning to say, if we all of a sudden ramp up the number of people we have, how are we going to make sure that we have the top level of care for every person that needs it? And that means we're really focusing on logistics.
Well, Dr. Gottlieb, we just heard that phrase, surge planning. What is the likelihood we might actually see a surge of patients in the United States? And what do the numbers out of China tell you about what we could potentially expect?
Well, I think what we need to watch right now is what's happening in Singapore, Japan, probably Hong Kong, where there seems to be sustained community transmission in those countries right now. And we need to know which way that's going to go. Singapore does seem to have cases that they can't trace back, so that suggests that this is spreading in that country. And I suspect that we're probably 3 or 4 weeks behind their experience. And so I think watching closely what happens there is going to be instructive. Remember also, it's quite warm in Singapore. It's also about 60 degrees in Wuhan right now. And so the hope is that the summer and the spring will be a natural backstop against transmission of this virus. But it seems to be spreading in warm localities. And it could be that this is such a novel virus where we don't have a lot of cross-immunity that it does transfer easily in warm weather.
Dr. Gottlieb, back to you on that same notion. The president today made sort of similar comments regarding warm weather would help bring an end to this. So there is something to that?
Well, coronas typically don't transfer in the summer. You don't see coronaviruses and they cause the common cold. You don't see them causing respiratory illnesses in the summer. And so the hope was that as you come into the warm months, that would provide a natural backstop against continued epidemic spread of this virus. That should be the case, but again, when you're dealing with something so novel, that might not be the case. If you remember with H1N1, the swine flu, when that first became epidemic here for the first time, it continued to spread well into the summer. We continued to see quite easy transfer of that.
Dr. Compton-Phillips, assuming we do see some level of a spike here in the United States, are hospitals ready here?
We're doing everything we can to get ready. It's everything from making sure we're having opportunities to preserve our personal protective equipment so that we can have things like respirators to keep ourselves from transmitting the germ through healthcare workers ourselves, as well as making sure we have everything from respirators to the novel antiviral agents that we're hopefully going to have available should we ever need them, making sure we have the systems in place where we can cluster the care so we can optimize the use of those resources. So we're really thinking through about how can we plan ahead just in case. I hope, as Dr. Gottlieb said, that we are not going to need it based on warmer weather coming around the corner. But if we do need it, we'll be ready.
Dr. Compton-Phillips, are you having any trouble acquiring supplies of personal protective equipment right now? We talked with one large health system last week that said they actually hadn't received a scheduled shipment, and the State Department of Health was stockpiling supplies just in case hospitals needed it. What's the situation been for you?
So we have not missed any shipments yet, although we know it's just a matter of time. As long as China is continuing to absorb all the masks basically that are being produced, we know that eventually our need is going to outstrip what the world supply chain is managing at the moment. And that's why we're looking at what are all the other alternatives we can to make sure that we can preserve the masks that we do have to use for the best and highest purpose.
Well, Dr. Gottlieb, thinking about, well, it looked like you were about to add a point there.
Yeah, I was just going to say the response to this really is a local endeavor, and I think we need to look at ways that we can backstop local health departments right now and hospitals that are likely to become referral centers if there are outbreaks in major cities. We have time to prepare. We got an early warning here with what happened in China, and we should be taking those steps.
We saw the footage just a few minutes ago of the spray that they're spraying in China. Is that thought to help? Do we know what they're spraying there? Is there any evidence that that could potentially help?
Well, scant evidence. I mean, perhaps it's going to inspire some confidence in people, but the problem isn't that this virus is on sidewalks. It doesn't really live very long on those kinds of surfaces. I mean, they should be putting more care into clean hospitals and places like that. But this indiscriminate spraying in the streets is unlikely to do much to help the situation.
Dr. Compton-Phillips, finally to you. Your advice this evening for any healthcare workers who may be watching our program, what should they do if they suspect a case or even somebody who walks into an emergency room saying they're feeling ill?
Well, people see a lot of people walking into emergency rooms saying they're feeling ill. And so the big question is, have you been exposed to anybody who's been traveling to China? And if so, making sure that we do all those precautions, putting masks on people, making sure we isolate people that are ill, washing hands frequently, not touching the face and mouth after touching any kind of surface or touching any kind of patient. So we know how to protect ourselves, and we just need to keep doing it. And knock on wood, the incredible levels of isolation and prevention we've done so far in the U.S. will continue to keep us all safe.